from the waiting room. And here we are. Welcome to Doctor with Zoom You Now. My name is Laura. I'm a principal consultant at PPL, and I'm very happy to welcome you all today for this exciting webinar. I have an incredible array of speakers today who will guide us through. Our chair will be Charlotte Augst from National Voices. So I will hand you over to her very shortly, but let me just give you a quick intro to the technicalities. We will keep you on mute as the speakers talk. Please use the chat throughout. We have several colleagues managing the chat, looking at it, so ask questions, write your comments, write your thoughts. We are recording this presentation. We're saving the chat. If you have any technical issues, please chat to me through Zoom, or you can also email me. I will put my email in the chat, but it is also here, laura.polo@ppl.uk. And now, with no further delay, I'm going to hand you over to Charlotte.
Hello everyone, my name is Charlotte. I'm the Chief Executive of National Voices. We're one of the partners in this project that we're talking about today, together with Traverse and Healthwatch England and some local health watches. National Voices is an umbrella organisation, it's the umbrella organisation for charities in health and care. We've got about 160 members, some really large ones and lots of small ones. We're talking today about our report that set out to investigate how people have experienced the transition to remote or digital experiences of care. A lot of this is about primary care, but it's not just about primary care. We have got Lucy here, who will talk from Traverse, who will talk about the research itself. And then we've got two people talking a bit about the context, Jacob and Sam, who were both involved in getting the project off the ground and seeing it to completion. And then we will, we have also brought some outside people into the conversation. Nikki, who many of you will know, who leads primary care for NHS England. I think you still work as a GP as well, but you know, a big chunk of your time is taken up thinking through what primary care now needs to look like. And then we've got Emma Stone. We're really pleased to have Emma here as well, who leads the Good Things Foundation, which is an organisation that works on digital inclusion and also is another umbrella organisation for loads of local organisations that help people access digital. So I will try to take up very little time, but I will bring people in through the chat, which is monitored by our colleagues, and I will try to give as much time as possible to the people who are close to the research and can share the content with you. But do please fire away your questions and your thoughts and your comments. We're really interested also in hearing whether any of you are conducting any inside work into these questions we're talking about today, or whether you think there's anything we should collaborate on. So before, without further ado, I think I'll hand over to Jacob Land, who is Director of Policy or some such thing at Healthwatch England, which is the organisation that looks after all the local health watches, but he might give a better rendition of what his job is, and he will give a quick introduction. Thank you.
Thank you very much, Charlotte. Good morning, everyone. As Charlotte says, I'm Jacob. I'm the Head of Policy for Healthwatch England. For those of you who don't know Healthwatch, although I'm sure most of you do, we're the independent champions for people who use health and social care services, and we work with our 151 local health watch around the country. I'm going to just talk a little bit about what we were hearing generally from people about non-face-to-face consultations before the pandemic, just to help set the scene. So in 2019, so last year, the Healthwatch Network embarked on a big project of research across the country to support the design and implementation of NHS England's long-term plan. And that involved us doing something like 500 focus groups, speaking at about 1,000 public events, and engaging in total about 125,000 people through our engagement work and online surveys. So we were engaging with a huge group of people, and in that, the issue of digital or non-face-to-face consultations did come up quite significantly. What was clear from all of those people was that actually many people hadn't had an actual experience of a virtual consultation at that point. And that's not unsurprising given what we know about the numbers of people taken up from official data. But clearly it wasn't something that people had a lot of experience of, but there was a big appetite for it. So people wanted to see greater use of technology. They wanted to see this sort of movement happen in the NHS. But there was a general sort of perception that the NHS can be a bit slow in adapting to using technology. And there were also some concerns around potential people being digitally excluded, so certain groups not being able to access care. Anyway, so that was where we were with the baseline in 2019. And when the pandemic started, and over the first few months, we saw a significant spike in people reporting experience of virtual consultations. Again, that's not unsurprising given what we were hearing about the official data and the volume of these types of appointments happening. But actually, it meant that we started to get a lot more experience data from people that can help us inform how they're actually working. What that early feedback has told us is that people recognise the pressure on the NHS right now. They've been impressed at how quickly things have changed. That's particularly in light of the previous comment about the NHS often being seen to be slow with technology. And people are very pleased that the NHS has continued to offer care in a socially distanced manner. So that's been very positive. However, the experiences of the actual appointments themselves have been pretty mixed. So what we've heard is that some people who were previously skeptical have now had an experience because they've been forced to have that experience of an online consultation or a virtual consultation, and they've been converted. That positive experience means that they're now on board with the idea and they think it works really well. And for certain groups like rural communities, people with physical disabilities, people who have been shielding, or those with ongoing health conditions, those are particular groups where we've seen positive feedback. We've also seen some evidence to suggest that experiences in secondary care, virtual appointments have been better than primary care. That may well be down to the type and the reason for the appointment and the familiarity with the condition that you're engaging in the appointment with. However, we've also seen some evidence to suggest that these sort of remote consultations are not suitable for certain groups in sort of any circumstance. In particular, we've heard from people with mental health conditions, people with sensory impairment, learning disabilities, autism, those sorts of groups who have particularly struggled with accessing online or virtual appointments. Sometimes this is for obvious reasons, so things like sensory impairments or language issues can understandable. Others less common things, or less immediately obvious. So people with autism, for example, telling us that rather than a virtual consultation happening in a safe space in their own home, actually they were finding them being invasive, the fact that those appointments are happening in their own home. So some really interesting detail coming out there. And I think overall there's been a broad concern that even though some people have liked it and some people haven't, there's a concern now of a blanket approach that everything might just be a digital first approach, and that we know that that's not going to work. We're starting to see questions being raised from people about why hairdressers and gyms are reopened, but GPs are not reopening physically. And so that this is clearly playing out in the public consciousness as a question of what the future is going to look like. And that's why we did this piece of work with Traverse and National Voices to try and work out what works for people and what they want to see in the future. And with that, I will conclude my bit and pass back to Charlotte. So I hope that's helpful as a background context.
Thank you, Jacob. Very helpful. So all three of us research partners are clearly motivated by the commitment that people's experiences of using services, and particularly those people who have greater needs of services, need to be at the centre of designing the next phase of our response to this pandemic. So placing people's experiences at the centre of our recovery efforts is sort of what we all have in common, which is why it felt like a very natural collaboration for us. I won't bore you with these sort of platitudes, because I'm sure the people who come on to this webinar all agree with that sentiment. And I think it's now time to pass the baton over to Lucy, who is the real expert, who was very involved in running the research project itself, and will walk us through the findings and the report. Lucy, are you there?
Yeah, thank you, Charlotte, for that introduction, and thank you, Jacob, for giving just a bit of background to that. Okay, so I'm going to give you just a sort of quick 10-minute walkthrough of the research that we did and what we heard. I think it's important to contextualize this, that we were, like everybody, trying to work within the constraints of the pandemic. So this is a fairly rapid piece of work, and it's delivered within that context. But I think it felt important to us at this point, as Jacob said, to try and produce something that started to get a handle on the breadth of experience. And you'll see as I talk through the results, that's one of the things that we really found. If we move on to the first slide, just Laura, there we go, thank you. Okay, so just to kind of contextualize this, we had done some traverses of research and engagement organisation, and we work in healthcare, but across other topics as well. We're researchers rather than healthcare specialists. And we had done early on in the pandemic, we'd done a bit of work about basically what was changing for people, what their experiences were of healthcare generally, whether they were having appointments, whether they're being postponed, whether they're avoiding seeking care. And one of the things we found from that was that people were receiving care in a whole host of different ways that we hadn't necessarily understood. And looking at the data, this is from some of Healthwatch's work, it's the shift from the volume of remote appointments pre-COVID to now is unprecedented. And as Jacob said, for the NHS, that kind of really rapid transition is really unusual. What was happening at the same time was that lots of the usual patient feedback mechanisms were suspended because there wasn't resource there to do those. So what we really wanted to do here was to do several things. One was to fill this gap around patient feedback, where the regional health watchers, for example, were hearing lots of feedback as they were talking to people, but we weren't seeing anything very systematic at this point in time. We wanted to really immediately respond to the fact that people were doing this, and regardless of what the strategy was, everybody was socially distancing and people were having remote consultations now. So one of the things that we'll share is a set of top tips, which are basically just things that people said would be helpful. Having done it once, this is what I wish I'd known. So hopefully that's helpful in supporting people now in the situation we're in. But we also wanted to start to inform thinking about best practice for the future. The third stat on here is that the BMA did a recent survey of GPs, and 85% of GPs want remote consultations to continue. So this is not something we're not just going to snap back to the old normal. And I think it felt important that we're starting to contribute to that discussion about, well, what does that look like, and where have we accidentally created really good experiences for people? So that's the kind of context for what we did. If we move to the next slide, I'll tell you what we did very briefly. So we had 69 people who'd had a remote appointment during lockdown. 49 of them we worked with online, and 20 of them we worked with through telephone interviews that Sam hosted for us. And we wanted to do a mix of online and telephone interviews so that we weren't excluding people who weren't online, who'd had remote appointments either by telephone. But we also wanted to make use of the fact that we could use this online platform tool that let us engage with people in a little bit more detail than a straightforward questionnaire. We recruited people via the local Healthwatch groups with a specific focus on the inequalities that we know are particularly relevant to COVID. So we were pleased to get quite a diverse group in some respects. We'd asked the Healthwatch groups who were recruiting to help us ensure that we had a range of diverse voices ethnically, although the samples skewed slightly towards older and female participants. It's fairly common in this type of research, but it's worth noting. And we had a mix of different appointment types, so outpatients, general practice, The smaller boxes there are mental health and then other. So we wanted to see a mix of people. So that's what we did. If we then look at what did people tell us, I said at the beginning that there was a real range of experiences. And one of the first questions we asked people was just, how did you feel about this experience, about your remote consultation? And there's this huge variety of experiences. Some people who felt really relieved to have had their appointment, who felt that they were listened to and informed and that they'd really had a really positive experience, to people who started out really nervous and, like Jacob said, had been a bit converted, to people who found the experience really frustrating and disappointing. So that's, even amongst that kind of 70 people we talked to, this huge range of experience feels really important. Breaking down what we heard in the next slide, we asked people to walk us through the process of how their appointment had been scheduled, how it was planned, how it happened, and what the follow-up was, so that we, in research terms, we asked people to focus on their recall of the events. And what we heard from people about the experience of appointments being set up the sort of period beforehand, interestingly, was a lot like the experience of anybody who's ever bought a washing machine and had it delivered. You just want to know when they're coming. If you've got to take a whole day off work to wait for an appointment, you really would just prefer to know when and who is delivering it. Is it one guy? Is it two guys? Are they carrying it in? Are they leaving it in the hallway? What exactly is going to happen? That was one of the key messages we got from people. And when that worked well, so in the quote here, when people were having a follow-up appointment and it was convenient, there's no travel time, there's no waiting time, that's a really positive experience. Where people had less positive experiences was when they just weren't certain of what was happening. And that's, in some ways, that can be trivial, right? You've just waited an hour waiting. In other cases, it was, actually, I needed to be somewhere that I could have a private conversation, that I felt safe and I could talk about something that was confidential. And by not being able to plan for the appointment because it wasn't scheduled to a specific time, I actually couldn't do that. And therefore the appointment was, the purpose of the appointment was frustrated. So I think that point around boundaries is really important for a whole range of reasons. And then the second thing that we heard was about preparation. So almost no one we spoke to had really any information in advance of their appointment to tell them what to expect or what they should prepare. And that was the key thing when we asked participants what would have helped. That was the thing that most commonly came up. People just wanted just a little bit of information in advance. And some of that might be just knowing what the format of the appointment would be, something that would give them a bit more confidence about what it was like. But there was also a sense that the experience of remote consultations was exacerbating some of the things we hear anyway. So this issue where you have to tell your story lots of times. People were saying, we heard reports of people who would have an online consultation and had to fill in a form in advance in which they had to give all the same medical data that they'd already had to give to their practitioner. People with long-term conditions who were having to basically give the same information again. So there's something about, are these systems plugging into what we've already got? Is there something happening there? But also just thinking through, if this is the first time we're doing something, giving people a little bit more control over the situation means just giving them a bit more information. If we move on to the next slide and just finish up talking about what people wanted before the appointments, we also heard a really interesting set of views about the format. So we hadn't really assumed that we hadn't really made any assumptions about what people would want in terms of telephone appointments versus video chats versus other tools. And what we found was just a real mix. So most people had telephone consultations, and actually quite a lot of people that we spoke to said that the video would have helped. And I suspect that's different from maybe 6 months ago. I think that maybe people are just a little bit more comfortable with video. We're using it socially more. People are more confident in it. So I think the message there maybe for the health service is actually to have greater confidence in it in patients as well, and that this is a tool that's useful. Some of the really positive experiences that people reported were where they'd had video appointments. although that's obviously not the case for everybody, there were also people who said actually just sometimes just a telephone appointment, like it doesn't need to be complicated, I just need somebody to ring me when they say they're going to ring me. So I think what we found from this was that people really wanted to have some choice about this wherever possible, and also for some thought to have gone into it. So having taken the time to just think a little bit about both what's appropriate and what level of digital literacy do people have, what are they comfortable with. So wherever possible, be able to offer a choice of appointment types would have been really, really positive for people. In terms of during the appointment, which is the next slide, this is not going to surprise anybody, but the quality of communication became really even more important, because in some cases when people are using telephone or on video, it's less easy to read the kind of non-verbal communication. It really became very important that providers and patients were just taking the time to communicate clearly, to confirm that they'd been understood. And the quote here is from one of the really positive stories we heard, which somebody had a physiotherapy appointment. And I think really just illustrates the opportunity in how remote appointments are working. So there's somebody who didn't know what to expect, but actually had a positive experience where they felt heard, they could ask questions, they could discuss. The appointment felt more personal, because usually this is a service that's delivered in groups or in a large room, and it felt more individual. And it was described as the most person-centered session. So I suspect this won't be a surprise to a lot of you, but the thing that people wanted through their remote consultations often was just a personal experience, an experience that was a little bit thoughtful about what they needed. So that was a kind of key theme around the appointment. I'm going to talk to two more themes and then hand over, because I'm conscious we've got lots to do. One is digital inclusion, which is my next slide. And I know that Emma from the Good Things Foundation is going to talk about this. I think it's just worth saying that across our research, we talked to people who had been offered remote appointments that weren't appropriate. We talked to people who found that remote appointments were better for them, actually were pleasantly surprised and found that for them, the experience was more positive. I think we hear a lot about digital inclusion. I think it's interesting to think about this from the perspective of what our current system isn't perfect. We're excluding people in all kinds of different ways from access to healthcare in the current system. What we're doing through digital inclusion is, in some cases, doubling down on that. So we know that some types of digital exclusion are associated with other types of exclusion, so social or economic, or to do with accessibility. But there are also examples where the technology is opening up opportunities for people to be included. So I think I think what we found from this is that it's a very mixed picture. It's important to think more, to think at it, just look at it in more detail, to not assume that it's just the case that there are one set of digitally excluded people, and if we can just post them phones, it'll all be fine. It's actually very much a mixed picture. And that brings me on to my last slide, which is where I wanted to finish, which was just to talk about some of the opportunities to test and to learn and improve. One of the really significant findings, I think, is that almost nobody we spoke to had been asked for any feedback about their experience of their appointment. And that's partly a consequence of where we are in terms of the pandemic, but I think it's interesting. This is one of the most significant changes to day-to-day medical practice in decades, and we're not necessarily learning from it. So I think that's really important, because there are some things, as in the top tips, that are really simple that I think we can do to improve the experience of patients now, and also to improve the experience for providers. I think that there are also plenty of medical professionals who just are adapting to this in real time as well. But I also think there are a set of opportunities that are really that we should be thinking about. One is, what does the format offer us? So when we asked people for suggestions from participants, several of them talked about that if they had access, if they were already online to do the appointment, could they have access to their notes? Could they record the session so they could come back to what their practitioners had said? Could they share their records? Could they share information? So there's something about how do we use tools to have a better and more in-depth experience. There's a question around accessibility, and as Jacob pointed out, for some people, remote consultations are much less accessible, but for other people, they were really helpful. And I've been spoken to some people with hearing loss, they found that actually, compared with a noisy waiting room, it's much easier to have a one-to-one interaction with closed captioning, say, but that's again not the case for everybody. And for some people, traveling to appointments is a problem in itself, and so being able to do it from home is helpful. But again, as Jacob says, for other people that's intrusive. So how do we shape something that makes the most of that opportunity, and not just assume that there's a set of people for whom this is not useful at all? And then finally, a point I wanted to end on, which is something that I've been talking about with colleagues a lot, is what's the opportunity here for us to think about how our communication, how we communicate, and how we talk to each other. This process of changing our communication methods should give us an opportunity to think about our routines and to think about the things that we assume, whether as patients or as practitioners. And I think it's a really interesting opportunity to think about that dynamic of when you're a patient, you go to the space of your medical provider, you go to their office, you follow their waiting room system, you are in a space that's different for you. Whereas the potential is that in this digital environment that we have this more equal space. And I think there's something for us to really think about there in terms of what does that challenge us to do differently? I don't know the answer, but I'm hoping that will be something that we can discuss. I'm also hoping I've kept time. I have. Excellent.
You've done really well. You've done really well. Laura, is there a follow-on slide whilst I hand over? Laura? Right.
We've got the top tips.
Yes, so that's something that we wanted to sort of make a little bit of noise about, because we think this is just a really nice little practical takeaway out of all this work that we've done. There's obviously loads of implications for policymakers and for people who need to think about how services are commissioned and evaluated and paid for and all the rest of it. But here is something that we think, you could in a way all print off and stick over your desk. And we have published this alongside the report as a sort of standalone pull-out, because we think it's just a really nice sort of practical summary of the things we can do almost in the meantime to make things a little bit better. So yeah, there's plenty to reflect on here, and we'd love to hear your feedback. But before we open to the floor, which will be facilitated through the chat, just by way of reminder, we won't be able to open microphones. We've got like 240 people on this call. It's not possible to do this open mic. I want to hand over to Sam Hudson, who is a researcher who National Voices have worked with quite a lot, and who is the one who conducted the interviews on the phone rather than engage with people on this online platform that Traverse looked after. And we were really keen to include this perspective in this research, because clearly it's no good just to talk to people who are on online platforms about how they find online platforms. So Sam conducted telephone interviews, some of them on the good old-fashioned landline. I don't know whether any of you remember what that is. And she will talk to us about where this work we've done seems to fit into what other people are doing, and just sort of open up that conversation. Sam, I can't see you, but I'm assuming you're here.
I am here. Yep. Thanks, Charlotte.
And now I can see
thanks,
you.
Lucy, as well. So really, just a quick advert, really. When we found out 2 months ago that we were all just embarking on very similar activities, so National Voices were, on behalf of NHS England, looking at the experience of waiting for care before and during COVID. And of course, as part of that, we wanted to look at the virtual experiences. And we quickly joined together and worked on this, the Doctor Will Zoom You Now piece of work. And over that time, pretty much everyone I speak to is curious about the findings, but also there's lots of people who are in this space doing similar things, and we can see from the chat this morning that there's huge enthusiasm, but also lots of activity. So we know of some groups who've been looking at what the staff experience was like, what it was like to very rapidly have to offer this type of care in the early days of lockdown. We also have spoken to people who work in industry, who've been developing all the tech and digital stuff, often for years in advance of this, the 2020, who are also, really keen to know how it's working. And also people who are starting to develop surveys and questions so that they can track the experience of virtual healthcare as it happens and make improvements locally. And so really this is just a plea to say, if you're doing anything or you've got plans to do anything, absolutely share it on the chat today, but also share the report with colleagues, and do stay in touch with us. All the contact details are in the report. And we'd like to know of any opportunities for joint working. We've got some ideas of our own, particularly around vulnerable communities and people who might be excluded. So we're quite keen to kind of keep that conversation going and do as much joint work as we can. So that's it really. Back to you, Charlotte.
Thank you, Sam. So, we are, obviously delighted that there's so many people listening to us today about this research. We had huge engagement with people in the system and in the VCSE before today's launch even. We've given a briefing to number 10 about this. Somehow they heard about this. So this is wonderful. It's obviously a very live issue, but what we also are a little bit worried about is that everybody will go off and do the same thing now. So, it's just not a good use of our scarce resource and the headspace we will need, frankly, for other things. If we all go off and interview 25 minority ethnic citizens and ask them about their experience of digital, can we please talk to each other about these plans we're developing and make sure that we really complement each other's work, add impact to each other's questions, make sure that we cover more ground together than if we could do if we all just soldier on in isolation. So this is really a heartfelt plea. If you've got plans, if you've got budgets, if you've got ideas, let's talk so that we can together really progress this agenda rather than everybody doing a poxy little piece of work. And then we're none the wiser in the end. Right. Not that this ever happens in the health landscape, of course. I now want to hand over, and I'm really excited about this, to Emma from the Good Things Foundation, and they do excellent work long before the pandemic about what it means for citizens and communities that so much of our life is now conducted online. Emma, what is your reaction to what you've heard today? Are you there, Emma? Don't know what happened there.
Hi. I was waiting for Laura to unmute me. Hi, everybody.
Okay. Hi, Emma.
Hi, brilliant. Yes, Charlotte, do you want me to introduce about our work?
Yes, that'd be great.
Yeah, fantastic. So Good Things Foundation, we're a digital inclusion charity, and we help people to take their first and further steps online. And so that's around helping people build their digital skills and confidence. And we do that through providing online learning, but it's learning that was designed for use in communities face to face. So trusted faces in local places as being the best way to help build people's digital confidence where they've not used the internet before. And I think for us, obviously, during lockdown, lockdown has really exposed the scale and the nature and the significance of digital exclusion. And digital has become an essential need. So not only in relation to being able to access services and health information, but just in terms of being able to stay connected, being able to do your homeschooling, being able to earn and work from home, if that's been an option for you. And when you were going through, and Lucy was going through the findings, I was thinking of a couple of people who have been supported through some of our partners during lockdown. So one was Firuza Salimi, and she arrived in the UK in Northumberland from Iran about 8 months ago. 2 adults, 2 children in Firuza's family, a disabled family member, barriers to accessing services linked to her English language needs, and no internet access. So Firuza, her digital lifeline was a community organisation that was a place where she could get access to the internet as well as the support to use it. So then when lockdown happened and that community centre needed to close its physical doors, she was really disconnected from everything that she needed to keep herself and her family safe and part of society. And then there's Mabel, who's 91 years old. She lives in Stockport, and digital was not for her until lockdown. And actually, COVID-19 changed that. She was supported to be able to get a tablet. I don't know whether she's used it for a GP consultation, but I do know that she has used it to stay in touch with family and friends in a way that she's better able to afford, and it's really helped her with her mental health and her loneliness. And Firuza and Mabel are just two of 1.9 million households who are offline. And interestingly and importantly, we know that before lockdown, 44% of those offline households were under the age of 60. So this isn't only an issue about older age. In fact, you are 3 times more likely to be digitally excluded if you have a disability, if you have an impairment, and if you live on a low income and in poverty. And also the data from before lockdown says that actually, even across the whole population of adults, only 66% of us, so about 2/3 of us, before lockdown had never used the internet or apps for our health and well-being, and that figure went up to 80% of people amongst those who have low digital engagement. And more recently, the Health Foundation was exploring the digital divide, and of those who said they would download the contact tracing app, well, 71% of those who have a degree said yes, and that figure fell to 38% of those with no qualification. So it's really stark, the links between digital exclusion and other forms of social and economic exclusion, which we know then correlate closely with health inequalities as well. So for the last few years, we've been funded by NHS England, then NHS Digital and NHS to run a programme called Widening Digital Participation. So that's been around how can you find ways to bring digital inclusion and health inclusion together. And so we find ourselves talking more now about the importance of building digital health literacy. So many of you will have talked and been familiar with thinking about health literacy. Well, let's not think of digital skills and digital literacy as something separate from that. Let's really try and bring those together and support people to use the internet and digital technologies, whether that's for their own health, self-managing conditions, for their well-being, for lifestyle change, for caring roles. And we think one of the best ways to achieve this is through, again, it's that community. It's blending all the benefits of digital with the importance of local community support. So we've developed a model called Community Digital Health Hubs, and I can share a link in the panel around that. So that's one thing for us, is really building that, building digital health literacy among the population, and especially for those who are most likely to be at the sharper end of health inequalities. And the second, as you've already said, is around co-designing digital health services and tools and approaches. I can't stress this enough. It feels as though there is a real risk that those who are designing digital health services and tools ignore those who have lower or limited skills, and where we then end up to is we're designing in inequalities rather than designing in inclusion. And that's really important as well in terms of some of the accessibility issues that have also come up through the research. And I think my third and final point to say from one of the other things that we've learned through widening digital participation is that we can't assume that all health and care professionals themselves have the digital skills and confidence they need. We will all have used digital in ways during lockdown that we haven't had to before, and we will all have struggled with our tech. And we can make a real mistake in assuming that just because you are a care worker or a practice manager or even a GP, that you feel confident in kind of using digital yourself. So one of the things that's been really helpful has been around training and supporting digital health champions who might be colleague facing as well as patient facing, and not expecting them to be digital experts. This is about the value of exploring digital together. We are all on a learning curve here. And I think what does feel really important, and I think really chimes with what you're talking about, is recognizing that all of us have a role in supporting patients, service users, citizens with building their own digital skills and confidence. So in that interaction within a GP appointment, within that virtual health and care experience, how can you positively use that to support people to develop their digital skills and confidence? Because we're not going to turn back the clock. This is going to be important for the future.
Thank you so much, Emma. Really interesting, and so many strong statistics there, so many strong numbers around some of the starkness of these inequalities, really. Right, on to our final guest today, Nikki Kanani from NHS England, a GP leader. Nikki, you know, so much stuff there that you might want to respond to. One of the questions that that has been handed to me from the chat is, do you think health professionals have a role in helping people to develop digital skills? But also, maybe I wonder whether you want to reflect on how we can help health professionals to improve their skills, and you know, is there a role for sort of peer support amongst, let's say, the primary care community, or to bring people up and make them more confident so that they can be more inclusive? Nikki, over to you.
Yeah, Emma, thank you. And I think Emma said it really well, actually. We need to help health professionals as well as our patients and our wider communities. But for just thank you for this report. I think it's really timely, and as you know, Charlotte and colleagues, I've recognised a few of the participants too. It has been a whirlwind few months, and we've all changed so much of what we do so quickly. This report is really timely because it's given us a moment to sort of pause and reflect on the changes that have happened and what we need to focus on now. And I thought I might just touch on my experience as a GP first. For the reasons that Emma mentioned, actually, it's really quite tricky. I mean, we were not a very digital practice before COVID happened. So we had walk-in surgery, so people would come in and, you know, the waiting rooms would be full, and it was actually quite a nice ambiance in the waiting room because people would know each other and they'd stay and they'd get seen. We had a website, but we didn't really have any other ways having digital kind of triage or consultation, and obviously COVID hit and we've had to rapidly change the way that we deliver care. And what's really interesting now, so I'm a GP 1 day a week, and I go in and I go through all of my electronic consults. So we're a practice that has an electronic consult first, and then I do my telephone calls, and then I bring people in or for a video consultation. And you know, I'm missing the face-to-face interaction, actually, and I am bringing people in a little bit based on the fact that actually I'm good at my job because I'm good at seeing people and almost putting a hand on and understanding what's happening. So how do we balance those things? How do we keep some of the brilliant digital innovations that have happened? Because actually it has helped. It has helped practices to be more efficient, but it's also helped particular communities to get the care that they wouldn't have got before. So I have a patient who has a sensory processing disorder. He really struggles coming into the practice. He finds it incredibly overwhelming, and now actually having a digital or a remote consultation has been extremely powerful for him. So how do we keep those benefits but bring patients and bring the professionals along with us? And I want to reflect on a point that Jacob made. He said, you know, patients are saying, you know, well, my hairdresser is open, why isn't my GP? And I suppose what I want to really reinforce is that primary care has been open through the pandemic. It's just been different. And I think the difficulty is if our patients are not feeling that it's open and not feeling that they can get the care that they need in the way they need it, that, you know, that's something that we absolutely need to work on. But we want to keep reminding people that primary care is open and has been open, because it's the remote triage is important, but actually the fact that knowing your practices there is important as well. And you know, digital is one way of accessing care, but it's not the only way. And we've got to remember that we need to create that space for people that need to come in and need to have that human contact. And then I was watching the chat, you know, if somebody's breaking bad news, actually in many cases they want to come in and have someone with them. And you know, video consultation doesn't always work, not just because of the tech, but actually patients have been telling me, well, I don't want you to see the inside of my house. You know, this is my space. The telephone works really well. If you need any more than that, you know, bring me in. So what we want to do is have the options there and make sure that people can build the skills. I was really interested to hear the views about video consultations, because actually that's absolutely right. Pre-COVID, we found quite extensively that people would say, actually, I don't like video consultations. But yeah, we've all had to do a version of Zoom quizzes, whatever, to keep in touch with our families. So actually, absolutely, maybe people are getting more confident with that, just as we are as well. So you know, we've produced guidance and training for clinicians, but we are still committed to producing more guidance, particularly co-designed with patients, to actually make sure that we can effectively give the preparation advice. The screen's still up there, I think. Top tips for patients, for professionals. We need to be able to give that advice for patients and professionals. And you know, even I was looking at that thinking, oh, there's some really good tips there that I'll be taking away from my practice. And how do we do that? How do we make sure that others can take that away? And I guess you'll forgive me for saying, in one sense, I'm not surprised that some patients have said, oh, actually, you know, it's a bit like the washing machine being delivered. I have to wait for 4 hours. You know, we've gone through a huge change. We haven't had the time to be as proactive as we would have liked to be. So, you know, give that preparation, plan a timed window in the way that we would like to, I think, particularly in general practice. That doesn't mean we shouldn't. That doesn't mean we shouldn't head towards that. And so there's a huge piece of implementation support going on. And I know some colleagues are participated today who are involved in that, to make sure that both the profession and patients get the support that they need. There was a conversation about how we learn from the changes, and Lucy mentioned absolutely right. We should be learning from the changes that we've got. We've got a deep dive evaluation that's kicking off to really learn more, working with digital suppliers, you know, professionals, with patients, to understand what usability really means, how do we make it usable, and how do we make solutions fit the range of different models, the kind of the agility that we now need to offer. I wanted to kind of make a final point though on digital inclusion. As you know, this is something that I really worry about. I worry about it in our most vulnerable communities, but I worry about it for people who don't speak English as a first language. So my grandparents have got, well, my grandpa's got dementia, my grandma's hard of hearing, and both of them only speak Gujarati. I mean, that has been difficult for the last 4 months while they've been shielding. And I think, you know, we were, as a family, able to bridge the gap that healthcare didn't provide. But we have to start thinking about how our patients who don't speak English are able to access care in the same way as everybody else. And Emma mentioned, you know, Lucy did as well, technology is a massive help in this. And we know that, I know of a practice with a big Polish community who's actually found the tech really, really helpful, and has been able to go, well, actually, we can remotely offer care that we didn't before, because actually we can do that through a digital platform with people who speak Polish, offering the care online. So that's really powerful. But actually, we know that that isn't common. We know that that isn't available across the country. So I guess what we need to do now is learn, reflect, and make sure that we can get to a place where the doctor-patient relationship is still key and crucial and kept at the heart of healthcare. But we're able for the best agile care we can, whether we have a pandemic or not. So thank you for this. We'll look forward to working with you and others to make sure that we really embed the learning and take it forward in a way that supports both our communities, but our profession as well.
Thank you so much, Nikki, for your reflections. I'm kind of a bit overwhelmed with all this chatting in the chat box, but I've got my people who tell me what's what. So one thing that's coming through quite clearly is a real appetite to try to collate stuff that you've already got, and then also maybe looking forward to coordinate a little bit what next steps might be. So I'm just going to volunteer Sam Hudson to collate what we already have here on the chat, or if you have other stuff, send it to her. Sam, that's all right, isn't it? I think
That's absolutely fine.
You would do that. Sam, can you type your email address into the chat again? But we can obviously also share that afterwards.
Will do.
We will send the list of resources you have shared today to everybody who attended or was registered for today's webinar. Going forward, coordinating what we might be doing going forward, I'm very happy for us to attempt that to start with, but if that turns into a proper job, we need to think through how we're going to do that. So I think we can hold that space for now. But if that turns into lots and lots of evolved conversations, then we need to think through how we're going to resource that, understandably. But I do think it would be fabulous if we could, offline next week, have another conversation about, okay, how does this all fit together, and what is a really important question? And one question that I'm hearing very loud, just glancing at the chat, is, what's the service model? What's the offer for people who will not just make the leap into digital? Some of those can be helped into digital, and how we're going to do that. But some of them need to still continue seeing people face to face. I am going to ask colleagues now to tell me what question I should pass to the panel. Jessie, do you want to tell me what question is washing up in the chat, and I will pass it to whoever is good to answer it.
Yeah, okay. So a question that I've just got here, which I think is, what is the opportunity for change in the best way moving forward, so that we don't go back to where we've been before and we take the best of what we've got moving forward?
Okay, so I think I'll, shall we go for another one? And then I'll pass them to the, is there another question we could chuck in?
I think another one that's been coming up is, how can we support people to be able to use the technology, using patient groups, using training that's available via practices or via outpatient teams, but how can we support and help people to develop the skills they need if they want them?
Brilliant. So Emma, do you want to take away that one? Like, what kind of support do people need to make their first and then their next step into the world of digital? And, you know, what do you know works in that space? And do you have any experience what works particularly in health and care?
So I think if we're talking about what supports people who are citizens and patients, might be carers, I think so we will be sharing the learnings from our programme. I think that it still is about that local relationship. So it was really interesting hearing Nikki talking about the GP and the patient relationship and how within the world of technology you keep that. I think one of the things that we know about what helps people who are taking those first and further steps is that actually that is best delivered by someone they trust, by someone who they can relate to, and so you know there's a brilliant community digital health hub which was run by an organisation called ASHA. They have peer workers. They are supporting people who are going through the asylum process, who are refugees, who are experiencing homelessness, who therefore can cross over some of those language barriers that Nikki was talking about. And so there is something here about how do we have an opportunity to support and resource the hyperlocal community organisations who actually are really, really well placed to help people with digital inclusion for their health and for their well-being and for other areas of their lives. You know, if we're taking a broader look at health inequalities here as well, it's not just about access to health services. And so there is an opportunity to kind of value and invest in some of that community infrastructure and build those relationships with GP practices, with CCGs. So I think, and one area would be what might be the commissioning frameworks at an STP or an ICS level that would enable that to happen. Social
That's a really good. Sorry.
Yeah, I was just going to say social prescribing offers a route, but actually one of the things we found was that it's really unevenly developed at the moment, and it wasn't always easy. So organisations like ASHA were having to work really, really hard to make that link with social prescribing link workers.
That's a perfect segue. We're launching the other side of the summer, a big report into the BCSE experiences of social prescribing, and yes, it is patchy. We did a webinar a little while ago on digital exclusion, and at that point you've just made came out very clearly there. We had colleagues from Leicester joining us, I remember, saying, you know, it's not good enough to just provide translation services. People actually need support. And they were saying WhatsApp is often a sort of gateway platform that people find most intuitive and easiest to use. And they were supporting ethnic minority communities, elders to access WhatsApp and to receive health information through that, and it worked really well. So yes, that's obviously music to our ears, that the answer, as so often is the case, lies in the community and in the infrastructure organisations that can support diverse communities. Nikki, there was a point from the chat that Jessie just raised around how can we make sure we don't lose the opportunities that are now arising out of all of this. You mentioned in passing in your quick response that you are that there is a deep dive going on. I've seen on the chat people would really like to know the details of that, but there's also, maybe you could flag the beneficial changes work. I just don't, it'd be useful for you maybe to sort of explain what the system's already doing to try to capture some of this learning and to make sure we don't fritter away the opportunities that arise.
Yeah, absolutely. Thank you. I think probably on the deep dive, it might be easier to send the details to yourself so that then you can cascade to members. The beneficial changes work is really interesting, actually, working with our improvement directorate within NHS E&I to capture exactly what it says on the tin, beneficial changes. So, you know, what has worked well, also what has not worked, what has worked less well, and what has been the particular environmental factors that have meant that the changes have worked well or less well, and then how do we replicate it? So we're working across both different conditions but different sectors as well to make sure that we can really lock it in and learn and keep iterating and learning, which will be the way that we can really bake in the beneficial changes that we've found, taking into account any of the kind of perverse outcomes that, you know, we want to try and move away from. So, you know, watch this space. I think it's something we're all really mindful of, really keen to engage with as well. So if we send the details through Voices, you can share that.
So National Voices, as together with many other charities, is a member of what's called the Health and Wellbeing Alliance, which is how the charity sector has been set up to engage with various system partners. And we've all been allocated a sort of work stream in the beneficial changes work. We, as National Voices, will look after elective care and 111. So if you have any inside intelligence on that, we'd love to hear that. 111, I think, is a really fascinating one for us to try to get right, because it's sort of a gateway into much else. Right. This has been fascinating, and so much wisdom pouring out of all of you in the chat, and we will capture that and we will try to make it more coherent for people. This has been a very kind of time-limited webinar. If we had known how much interest there was in this work, we would have made this a longer session, but we are where we are, so it's time for me to wrap it up now. So we will write to all of you with the report. We will send further down the line, we will send you the report now, but further down the line we will send you a bit of a summary of what we've heard and the suggestions you've made for stuff that's already going on. We will have a go at trying to coordinate what plans are emerging from all of you and others, and we would love to hear your insight and intelligence and your ambitions in this space. Before we clock off, I just want to thank you, our research partners, Traverse and Healthwatch England. It's been fabulous working with them. I think what we've learned again, which is not new, is that if you don't care who gets the credit, you can get a load done. But maybe more importantly, we want to thank local health watchers who've helped recruit people into this study, and National Voices members who have helped recruit people for interviews and have been very generous with what they already know about what works for people. And finally, and really importantly, we want to thank all those people who gave up their time to be interviewed and to take part in the panel engagement. We couldn't have done this work without you, and we hope that you feel that we've put your experience to good use. Thank you everyone for attending, and have a good weekend when it comes. And also, probably I won't speak to any of you before August. Have a good break over the summer. There's plenty of work to be done, so it's important that we get some rest too. Take care, everyone. Goodbye.